cupping demonstration here. So the first thing you want to remember is when you go get the cups from the wet dry room, okay, you only want to take the ones that are labeled disinfected. Make sure that they're dry, that there's no residue left from the chemical disinfection on the cup. If there is any chemical disinfection left, please put a glove on and then wash the cups off and then dry them. Put them in the carrying basket. Lay either a chuck in here or paper towels so that you can carry these back to the wet dry room when you're done, and then disinfect, which we'll do in a separate video. So first and foremost, your patient will be laying on the table. You want to determine which hand you're going to hold your flame in and what side of the table you should be on. I'm right-handed, so I tend to want to use the cup, hold the cup in my right hand, so I'm going to hold the flame in my left hand away from the patient. So we would have the patient lying down. We would first lubricate their skin with a little bit of oil or liniment and then position them, and then we'll go into preparing our cotton ball to be lit. So remember, we're going to use only the 91 or either 99% alcohol. Either of those are suitable. So insert the cotton swab in there and squeeze out any of the excess residue of the alcohol. You don't want it saturated and dripping because that's potentially could be dripping on you. Make sure you cap the alcohol back up, and then best case scenario is just to move it away from where you're going to be working at. So I'm working on the table here, so there should be no problem. I could leave it on the table if I wanted to. So now we'll go ahead and light the flame. And again, I want to make sure that I never bring the flame over the patient like this. I need to bring the cup to the flame and then to the patient. So the cup should generally be kept at about a 60-degree angle. I'll bring the cup to the flame and then directly to the patient, just like that. Very quickly. Do not leave the cup over the flame for very long. Sometimes the cups are cold. You can gently warm them before you place them on the patient. Check them on your own body. Once you do that and you know that's suitable, then you can take the cup, again, bring it to the flame, place it on the patient's body. Extinguish the flame by putting your hand behind the cotton ball and then blowing firmly. So, and then from there, you can do your cupping and complete whatever procedure you need to do with cupping, whether it be moving or stationary cupping. Be mindful, blood and body fluids can certainly be brought up through the cupping procedure. Sometimes you'll see it, sometimes you won't. So when you're done cupping, if you're going to place cups down, please do not place them face down on the table like this after they've been on the patient's body, okay? Either place them face up if you're going to reuse them again, or even best case scenario, hopefully you don't need to place them on the table, just put them back in the basket so that they can be taken back to the wet dry room and then cleaned. That should cover us in regards to cupping safely. Thank you. Okay, so now we're in the wet dry room and we're going to disinfect the cup. So the first thing I had to do was go get a couple paper towels because we actually didn't have any in the dispenser. So if that happens, just grab one before you actually need to come in here. Otherwise, hopefully they should be here right at the sink. Make sure you glove up before you do this. You do not want to be handling this. This obviously could have blood or body fluids on the cup, and you don't want to be handling the disinfectant without gloves on because there's some potential that it could be harmful, maybe carcinogenic in long-term exposure. So if it kills organisms, it could kill you. So we want to take the cup out of our basket. First, we'll go ahead and take our paper towel and we'll get a little bit of Dawn on here, which usually will be good about getting any of the oils off. Turn our water on, grab our cup, and thoroughly scrub and rinse with the paper towel, inside and out. So if there were blood or body fluids inside the cup that were visible, you would want to wipe those out with a paper towel first and then dispose of them in the garbage. If it was a saturated scenario, you would need to put that in the biohazard red bag. So just make sure you thoroughly get all the oils off because those are the kind of things that will damage the cup if they're not removed before they're disinfected. So rinse all your cups off. We've only got to do one here. We'll put that in the staging area. Now the other thing we need to do is to rinse the basket because there certainly could have been exposure That paper towel is not going to be a protective barrier. If there was a chuck inside here, that could act as a protective barrier where we may not have to wash this, but from an expense standpoint, we may not have that luxury today. So again, just get all the oils off as well as possible with your basket. And then we'll throw our paper towel away. Should only take a couple minutes for you to do this procedure, depending on how many cups you have. Shake that off. I'll use the back of my hand as much as possible so that I don't have to touch this area, okay? Now, ideally, I would have said even open this up prior to doing anything, okay? Because my hands are not necessarily clean. We'll take one of the PDI Super Sani wipes out, okay? And just for sake here, I'll leave that open in case I need to use it again. We'll go ahead and swab thoroughly inside and out. Of our basket. Okay. And then we'll do our cup. Again, thoroughly inside, especially around the lip, which is where it's going to have come in contact with the patient the most, and then the outside of the cup. Once you've done all that, make sure that there is liquid on here. If they dry out, go ahead and grab another one. Go ahead and put it on the drying rack. These only need 2 minutes of contact time technically to be disinfected. Probably 10 minutes is better. For cleanup though, since I potentially maybe touched an area that could have been, exposed to blood or body fluids, hopefully not blood, but I can go ahead and wipe my containers down. I can go ahead and wipe my surface down of the counter that I might have been working on. I could go ahead and wipe down the handles of all the faucet and area of the sink that I might have worked at. So now we basically disinfected our area for the cup and for the sink. And then when you're ready to take your gloves off, go ahead and grab them, pull them off with one, and then you can come to the back side here, reach underneath and pull it off there so you're not touching either the inside of the cup. All right, and then dispose of that in the garbage and you're good to go. Alright, so we're going to show basically proper procedure for needling. So I'm going to go ahead and mark the point on Edmund. Edwin, we're going to do stomach 36 here. So we'll just mark it out as if we were in clinic. Okay. So at this point, I haven't set my clean field up yet. I need to think about what I'm going to do so I can set the clean field up. So I've got my needles in my box here. So I'm going to go ahead and open my box, but I'm not going to take anything out yet because my hands are dirty and we want to take clean needles and put them into a clean field. So I'm going to go down the hall here and we're going to wash hands.
Okay, this is the one with the okay.
So make sure you use the foot pedal down here. Turn the water on. Get some soap on your hands. Do the palmar and dorsal surface, front and back. Usually at least a minute is good if you can. 30 seconds at the least. So using the foot pedal, I don't have to touch the handle at all. Now I can get myself dried up. I'm going to bring extra paper towels because we're going to need them. Alright, so I'm going to use a Kleenex here for our clean field. Use a paper towel. This is fine. Hands are still clean. Now in order to get the cotton balls out, I don't necessarily want to grab this since I just washed my hands, so I can just use this to take the lid off. Go ahead and get however many cotton balls out you think you're going to need. Usually more than one, because you're going to have use a cotton ball for different areas. So, and I will make mention that go ahead and grab this so I don't have to Again, touch this. Now if I have an issue where I did touch something like that and I've come in contact, I can always go ahead and use the hand sanitizer to re-disinfect my hands, okay? So I do want to make mention too, when you're using cotton balls to swab areas of the body, typically don't use one to do everything. You can use one to do the upper body and one to do the lower body. Don't use the same cotton ball to swab yin tongue that you did kidney 1 with, okay? So.
Thank you.
You should think this would go without saying, but sometimes we're not paying attention. So go ahead and swab the point. Usually 1 stroke in a direction is good. We don't need to do much more than that. Throw your cotton ball away, okay? Hands are still clean because I came in contact just with this skin through the cotton ball. So now I'll go in and get out a needle. And for this venture, hopefully all we need is 1. So we might need more. I would go ahead and put those in the clean field, okay? Clean hands only in clean field. If you're uncertain if your hands are clean, go ahead and use the Purell and just clean them up. Okay, so that's if I touch the body in any way, shape, or form. So we'll go ahead and take our needle tab out. I do not have a stainless steel tin, so I just go ahead and use the garbage can for that. So, but if you did have one of your round tins, just set it in front of the patient on the table, and that way you can throw all your needle trash there. You want to make sure that you get guide tubes and things like that out of your hands as soon as possible. So in this case, we've already found the point. I really don't need to palpate again. I'm just going to go ahead and place the needle onto the skin and then tap the needle in. Okay. You should have enough force with the insertion of the needle that should stand up on its own. Then go ahead and get the guide tube out of your hands. I always recommend to students that they place one hand on the patient, okay, so that they can feel and sense what's going on with them, and then go ahead and insert the needle slowly to the point. How you doing, Edwin?
Good.
Any sensation there?
Yeah, right
Okay.
there.
Perfect. Got it in, it stands up. I kind of felt like there was some tension around the needle, so we're good. Okay. So at this point, when we're ready to remove, again, if we want to make sure, I did touch his body, okay? So I can go ahead and again, just clean my hands again or go wash them. Either one's fine. Usually when I'm in private practice, I go wash my hands and come back and then grab cotton balls and take the needles out of the patient. So go ahead and grab your cotton ball. Cover it, pull it out. The reason cover it, you never know when you take a needle out if it's gonna bleed. So just give it a second, check it, we're good to go. I put the needle in the sharps container. The sharps container doesn't have any needles sticking out, so it's at a good place, okay? Do not throw cotton balls that have covered points into your stainless steel tin. That should really only be exclusively used for the needle trash, okay? So make sure this stuff goes in the garbage because it's come in contact with the patient. Okay, from there, we're good to go. We can go ahead and have the patient position them and get them up to leave. And that kind of completes our process for clean needling. Okay, we're going to show bleeding cupping here. So as far as the clean field goes, it's the same procedure that we do for the needling. We're going to wash our hands. We're going to open our box, go wash our hands, and then take our lancet out, set it in our clean field with some cotton balls there. Now with bleeding cupping, you certainly have a potential issue here in regards to the bleeding, so that we're gonna have to deal with. So we're gonna go ahead and swab the skin with alcohol. I usually also have a couple of cotton balls that have alcohol on them that I will leave out. For that reason, because that sometimes we need to re-swab the area we lanced in order to keep it bleeding, okay? So we always want to place a chuck under the area that we're bleeding so there's a barrier between the patient and the table in case any blood happens to run down the side of our leg and then ends up dripping onto the table. So if we have a chuck there, we have a protective barrier. Now with bleeding cupping, it's recommended that you double glove, and the reason being because you're having direct exposure to blood for this procedure. There could be micro tears in the glove, and also sometimes as you're working through and kind of dealing with the the remnants of the bleeding, which would be cotton balls that could have blood on them. Sometimes it's nice to have another pair on them if you just need to take these gloves off and dispose of them. So we'll go ahead and double glove. So at this point, we want to make sure we do our procedure with the bleeding aspect as clean as possible. And then we'll go ahead and apply a cup afterwards to help accentuate some of the bleeding. So we picked a vein on the back of Mandy's leg here that we can access. So we're going to go ahead and tear off our protective tab of our lancet. It's always a little bit more awkward handling things with a pair of gloves on. You have less tactile sensation of your fingers, so be careful. At this phase, if you poke yourself, no big deal. After you poke the patient, then we have a little bit more of an issue at hand. So we'll pick one spot on her and we'll bleed one of these darker veins real quickly. For bleeding, the clean technique is one insertion and that's it per lancet. So we don't want to use one lancet and poke an area multiple times. So if we were going to do multiple areas, we want to have multiple lancets out. All right, so Mandy, take a deep breath in and exhale. And it's in and out like that, okay? Sometimes it will bleed, sometimes it won't. I'm just going to swab there a little bit, and we've got a little bit coming up, okay? So we pricked to bleed the one spot there. Now I've still got the lancet in my hand and the cotton ball that I swabbed that area with. So these things are dirty, so I'm going to definitely dispose of the lancet first. All right, so we threw our lancet away. We're going to take our cotton ball and throw it away too. Sometimes I like to keep blood saturated things like cotton balls or paper towels or anything like that in my gloves and go ahead and slide it off. That way it's protected. If someone who's picking up the trash, they're not going to come in contact with it if it's already encapsulated in the glove. So we're just going to go ahead and remove those top two layers, which can be a little bit tricky sometimes. Now I've got clean gloves. Okay, I can go ahead and apply our cup to the spot to help accentuate some of the bleeding. And then we can let that sit for a few minutes. We'll denote whether or not it helps any of the blood come out. Now there's something to be said when you're taking the cup off. If there actually is blood within the container or around the cup, you want to make sure that you have a paper towel or a tissue, and that whatever side you're going to open it from, you cover that up. You definitely want to open it away from you. That way blood doesn't splatter towards you. So cover that area, press your finger down slowly, let the cup come up, and you've got that there. Okay. We would want to make sure that we put that face up or in our basket. And then I've got cotton balls here that we can go ahead and clean the point. Okay. So once we've done that, we can have her lift up. Lift up, Amy. We'll take our chuck out. If it was saturated, we can fold it up and place it in the garbage can. Again, if it's so saturated that there could be potential for bleed through, make sure that that is put in the red biohazard bag. When you're done, go ahead and remove your gloves and throw those away, and then you're good to go. All right, now we're going to go ahead and just show you briefly what we need to do once we're done with the patient. We need to clean the tables. So we want to probably go ahead and take the pillows and put them underneath for the temporary moment. Go ahead and take your paper, fold it up. Nice tight ball so it doesn't take up so much space in the garbage. Okay. And then something important to do is check these crevices here. Make sure that you don't have any loose needles that have fallen down. Like we got a guide tube cover there, that's not too big of a deal. We just want to make sure there's no loose needles that may be sticking up. That way if we're running our hand across there, we don't catch a needle stick accidentally. So check and make sure those things are good. So at this point, we just want to use basically a low-level disinfectant. So we're going to use the PVI Standing Cloth HB wipe with the green top for this. The purple wipe will be the ones that we use for cleaning the cups and gua sha tools. So go ahead and put gloves on. One glove may be sufficient, okay? okay? Unless you're gonna use the other hand. I'm gonna go ahead and see if I can just do it with one. So, start with just one wipe, if possible. Okay. You can start up at the head and clean the table. And you can see that there's moisture on there, then we're pretty good to go. Generally speaking, for these vinyl tables, one wipe should be sufficient to get this clean enough for all intents and purposes. So, especially like when you're sliding in here, you would definitely want to be careful because if there was a needle there, it could definitely catch you. So like I said, this is a low level disinfectant. It does kill 100 organisms. So we want to make sure that it doesn't kill us. So we wear gloves and protect ourselves. Then obviously if the patient was on a pillow, we can go ahead and now put the pillow up on the table. Grab another wipe. Do the one side of the pillow. Flip it over. Do the other side of the pillow. Two pillows. We'll go ahead and do the other pillow. Be as thorough as you can. Okay. And then we can stack the pillows up like that, and that way they can dry a little bit more efficiently. Now, if we did happen to have blood on the table from something, maybe bleeding, or you pulled a needle out and they bled and you just didn't pay attention, you came back, you saw it on the paper, go ahead and wipe anything up first with a paper towel, and then come back and clean with one of these. Get that area good and cleaned, and then you may do a second one over it at the end, okay? So that should take care of cleaning our surfaces. This can also come to apply to your working space here where you're feeling pulses. These tables need to be cleaned periodically too. Elbows and arms are touching them. So at the end of the night, if you want to wipe down your table, your lamp, even the outside of these containers here, this would be a good practice just to get them clean since we're going to be touching them from time to time.
Okay, we're going to demonstrate proper draping for gallbladder 30. So first thing we want to do is we'll have a drape covering the lower half here. Whenever you're adjusting the drape, if it's stuck somewhere, we don't just pull it. We find the spot and hold as we adjust to make sure it's not stuck. And then as we go to expose gallbladder 30, we're going to hold about on the sacrum, fold over diagonally, and we're just going to do a little tuck on the inside of the leg here to help hold it in place. And then we can go ahead and find the point.
And that tuck is on the left side of the leg.
On the inside, I'm about 3 to 4 soon above the popliteal crease. Okay, now we're going to show proper draping if we wanted to needle stomach 31. So in order to find this, we have to find the ASIS of the pelvis and the lower border of the pubic bone. Now we're not going to palpate down that low. So what we'll do is first we'll palpate the ASIS and do a diagonal fold here, tuck that in about mid-thigh. Then we can adjust that draping over just a little bit. And up above, like near the navel, I'm just making sure that our draping is in a good position. Now I'm going to come around to this side so everyone can see. Now with the ulnar side of my hand, I'll start up a bit higher, and I'm gonna palpate the top of your pubic bone. Okay. All right. So there's the top. Can you palpate down further from my hand and find the lower edge of that? That's right near the genitals, so that's where we're letting you show us. Now I'm going to go over to the side where Mandy just palpated and the ASIS, and I can carefully adjust my drape so that my needling site is free and everyone's comfortable.